Pancreatic cancer. Pancreatic cancer is one of the deadliest cancers because it often grows silently and spreads aggressively before symptoms appear. It typically originates from the cells lining the pancreatic ducts, most commonly as pancreatic ductal adenocarcinoma. These malignant cells multiply rapidly and frequently metastasize early, especially to the liver and lymph nodes. Because the tumor tends to remain asymptomatic in its early stages, the disease is usually discovered only once it has become advanced and inoperable. This late diagnosis is a key reason for its high death rate. The 5-year survival rate remains grim, only around 10 to 13% in wealthy countries, and as low as 1% for stage 4 cases. Symptoms often appear only once the cancer has spread, and may include dull abdominal or back pain, unexplained weight loss, jaundice due to blocked bile ducts, fatigue, nausea, and indigestion. Globally, although not among the most common cancers by incidence, pancreatic cancer is among the deadliest. Risk factors include smoking, chronic pancreatitis, long-standing type 2 diabetes, obesity, and inherited genetic mutations, such as BRCA2 and Lynch syndrome.
Lung cancer.
Lung cancer is deadly because it often spreads before it causes serious symptoms, and it's responsible for more cancer deaths than any other type worldwide. It starts in the lining of the lungs' airways, most commonly as non-small cell lung cancer, which makes up about 85% of cases, or small cell lung cancer, which is responsible for about 15%. Small cell lung cancer is more aggressive and spreads faster. In both types, the main cause is damage to lung cells from harmful substances, especially tobacco smoke. These damaged cells begin to grow uncontrollably, forming tumors that can spread to the brain, bones, liver, and other organs. Because lungs are filled with blood vessels and lymph channels, lung cancer often spreads early, making it harder to treat. The 5-year survival rate is only around 26% overall. If caught early, it can be more treatable, but only about 1 in 5 cases are found at an early stage. Most patients are diagnosed after it has spread. A family history of lung cancer slightly increases risk, and diseases like COPD are linked to higher risk of lung cancer due to chronic lung inflammation or damage. Smoking dramatically raises lung cancer risk. About 85 to 90% of lung cancer deaths are attributed to tobacco use.
Breast cancer.
Breast cancer is the most common cancer diagnosed in women worldwide and remains deadly when not caught early. It usually begins in the cells lining the milk ducts or lobules of the breast and can spread to lymph nodes and distant organs if untreated. Its development is often linked to hormone exposure, inherited gene mutations like BRCA1 or BRCA2, and certain lifestyle factors. While breast cancer can be highly treatable when found early, it still caused nearly 700,000 deaths in 2020. And it is especially dangerous in areas with limited access to healthcare. Early signs include a painless lump in the breast or underarm, nipple discharge, changes in breast shape, or skin dimpling. When found early, localized breast cancer has a 5-year survival of about 99%. Treatments may include surgery, radiation, chemotherapy, hormone therapy, and targeted drugs. Key risk factors include early menstruation, late menopause, never having children, alcohol use, obesity after menopause, family history of breast cancer, and specific inherited mutations.
Glioblastoma, GBM. GBM is the most aggressive and deadliest brain tumor in adults. It forms from supportive brain cells called astrocytes and is classified as a grade 4 cancer, meaning it grows and spreads quickly within the brain. GBM does not spread to other parts of the body, but it invades nearby brain tissue in a way that makes it nearly impossible to fully remove with surgery. The tumor creates its own blood supply and kills surrounding healthy brain cells, leading to rapid damage and swelling in the brain. It usually forms in the cerebral hemispheres and most commonly develops in adults around age 64, though it can happen at any age. Most cases arise suddenly, without warning or known cause. Symptoms often include severe headaches, seizures, memory problems, personality changes, speech issues, weakness, vision problems, and increasing drowsiness. These signs usually appear and worsen quickly. Even with surgery, radiation, and chemotherapy, the median survival is only about 12 to 15 months. Less than 1 in 20 patients survive 5 years. U.S. Senator Ted Kennedy died of GBM in 2009, just 15 months after his diagnosis. Liver cancer. Liver cancer is one of the deadliest cancers worldwide. It develops from liver cells, usually in people who already have chronic liver damage, especially cirrhosis. Cirrhosis is long-term scarring of the liver caused by hepatitis B or C infection, heavy alcohol use, or fatty liver disease linked to obesity and diabetes. Over time, repeated injury and repair in the liver can cause cells to mutate and grow uncontrollably. The cancer tends to invade nearby blood vessels early, which helps it spread within the liver or to distant organs like the lungs. Liver cancer is often silent at first. As it grows, symptoms may include upper right abdominal pain, bloating, jaundice, weight loss, fatigue, or easy bruising. Many patients are already very ill from liver disease when diagnosed. The overall 5-year survival is low, around 15 to 20%. Late diagnosis and limited treatment options in cirrhotic patients are major barriers. Ovarian cancer, high-grade serous carcinoma. High-grade serous carcinoma is the most common and deadliest form of ovarian cancer, often called a silent killer because it usually spreads before it causes clear symptoms. It often begins in the fallopian tubes and spreads to the ovaries and abdominal lining. These tumors grow fast and aggressively, often spreading across the abdomen rather than forming a single large mass. They are almost always linked to TP53 gene mutations, and in many cases, to faulty BRCA1 or BRCA2 genes, which impair DNA repair. Because the ovaries are deep in the pelvis, tumors can grow large before causing discomfort, leading most women to be diagnosed only once the cancer has already spread. Key risk factors include having mutations in the TP53, BRCA1, or BRCA2 genes, a strong family history of breast or ovarian cancer, never having been pregnant, early first periods, and late menopause. Endometriosis may also increase risk for certain subtypes. Taking birth control, having multiple full-term pregnancies, and breastfeeding reduce a woman's risk. Actress Angelina Jolie brought major attention to ovarian cancer risk when she chose to remove her ovaries preventively due to her BRCA1 mutation, sparking worldwide awareness of cancer genetic testing. Colorectal cancer, CRC. CRC is one of the top cancer killers worldwide, causing over 900,000 deaths in 2020. It begins in the lining of the colon or rectum, usually as small benign growths called polyps. Over many years, these polyps can collect mutations in key genes like APC, KRAS, and TP53, eventually turning into cancer. Early detection is critical. Screening tests like colonoscopy can find and remove these polyps before they become deadly. Key risk factors include being over age 50, though cases in younger adults are rising, diets high in red or processed meat, low fiber intake, obesity, lack of physical activity, smoking, heavy alcohol use, and family history. Some individuals can also have higher risk for colorectal cancer if they inherit damaging mutations in the genes associated with Lynch syndrome. Symptoms often don't appear until the cancer is advanced. They can include blood in the stool, constipation or diarrhea that won't go away, stomach pain, unexplained weight loss, or iron deficiency anemia. Rectal cancer may cause pain, bleeding, or the sensation of incomplete bowel movements. Actor Chadwick Boseman's death at age 43 brought major public attention to early-onset CRC and the importance of timely screening. Acute myeloid leukemia, AML. AML is a fast-growing cancer of the blood and bone marrow that causes immature white blood cells, called myeloblasts, to multiply uncontrollably. These abnormal cells crowd out the normal blood-making cells in the bone marrow, leading to a dangerous drop in red blood cells, platelets, and healthy white cells. As a result, patients quickly become vulnerable to infections, bleeding, and fatigue. AML is not a single disease. It includes several subtypes based on genetic mutations like FLT3, NPM1, or chromosomal changes. Some forms arise suddenly, while others evolve from earlier blood disorders or after chemotherapy for another cancer. Key risk factors include being over age 60, smoking, prior exposure to chemotherapy or radiation, certain genetic conditions like Down syndrome, and blood diseases like myelodysplastic syndrome. AML is more common in older adults and tends to be more aggressive in this group. Symptoms include fatigue, fever, frequent infections, easy bruising, bleeding gums, bone pain, and sometimes swollen gums or skin lesions. Esophageal cancer. Esophageal cancer is a deadly malignancy that forms in the esophagus, the tube that carries food from the mouth to the stomach, and is lethal because it spreads early, presents late, and is difficult to treat once advanced. There are two main types: squamous cell carcinoma, found in the upper or middle part of the esophagus, and adenocarcinoma, usually in the lower esophagus. Squamous cell carcinoma is strongly linked to smoking and alcohol use, while adenocarcinoma often develops in people with chronic acid reflux or Barrett's esophagus. The esophagus lacks a protective outer layer, allowing tumors to invade nearby organs and lymph nodes quickly. Symptoms typically do not appear until the cancer is advanced, which severely limits treatment options. Common signs include difficulty swallowing, weight loss, chest discomfort, hoarseness, and bleeding. The global 5-year survival rate is only about 21%. In many parts of the world, particularly Asia and Africa, the survival rate is even lower. Major risk factors include tobacco, alcohol, obesity, poor diet, and chronic reflux. Most patients are men over 60. Gallbladder cancer. Gallbladder cancer is a highly fatal cancer that starts in the gallbladder, the small organ under the liver that stores bile, and is deadly because it grows silently, spreads early to the liver and bile ducts, and is rarely caught in time for curative treatment. Most cases are adenocarcinomas that begin in the gallbladder's lining, often triggered by long-term inflammation. Gallstones are present in the majority of cases, especially large, chronic stones that cause irritation over years. Other risk factors include being female, older age, obesity, certain ethnic backgrounds, such as in northern India, Chile, and Native American populations, and anatomical abnormalities like an abnormal junction of the bile and pancreatic ducts. Once a tumor forms, it tends to invade nearby liver tissue, lymph nodes, and can spread to the abdominal lining. Because the gallbladder can stretch to accommodate growth, cancer may go undetected until it breaks through the wall or blocks the bile ducts. Many cases are only found incidentally during surgery for presumed benign gallbladder disease, highlighting how elusive early diagnosis often is. Li-Fraumeni Syndrome. Li-Fraumeni Syndrome is a rare but deadly hereditary cancer syndrome caused by mutations in the TP53 gene, a critical tumor suppressor responsible for repairing DNA damage and halting abnormal cell growth. This mutation leaves cells vulnerable to unchecked division, leading to a dramatically increased lifetime risk of developing multiple aggressive cancers. The condition is inherited in an autosomal dominant pattern, meaning a single copy of the mutated gene is enough to cause disease. It shows high penetrance, so most individuals with the mutation will develop cancer, even at an early age. Prevalence is estimated at 1 in every 3,500 to 5,500 people, though certain populations, such as in Brazil, have higher rates due to founder mutations. Over half of affected individuals develop cancer before age 30. By age 70, nearly all carriers will have developed at least one malignancy. Cancers include breast cancer, sarcomas, brain tumors, and adrenocortical carcinoma. The risk for developing a second cancer is exceptionally high. Survival depends on early detection. Protocols like full-body MRI screening have improved outcomes, but no cure exists.